Thanksgiving, I had 2 patients that came in from out of town from Tennessee. This is one of them, the other one's running the camera. And I wanted to make sure that we got 2 visits in because he had an ACL reconstruction that, shockingly enough, didn't get back to 100%. So I want you guys to listen to what he says about conventional PT and ACL rehab and what we did with him in 2 visits and what the difference is. So go ahead and just give us a quick breakdown of your first rehab.
Yeah, so first of all was 0 prehab. I had to force the issue to get 1 prehab session, so I had no movement in my knee, rushed into surgery, 5 weeks after injury and doing nothing. Come out, first 6 weeks non-weight bearing, had some meniscus problems. I was just really forcing my knee to bend, to extend. Had to go on drugs to get more bending forced into it. I was doing all exercises at home, doing everything I was told, but it all came back to strengthening and lengthening, and I just didn't feel that that was going to solve this problem. And then I get back to sport specific exercises and just had a lot of instability. Like the surgeon said my knee felt stable off the ground, but when my foot was on the ground, no stability. So yeah, came to see Rhett out in Denver, and within just 2 sessions, he's got me cutting and he's got me feeling like so much more athletic on my feet, and so I feel ready to go back to soccer as soon as possible at this point.
So when they were working with you, tell us what your rehab, like how long was a PT visit, how much of it was one-on-one with an expert, how much of it was just doing exercise on your own?
Yeah, so outside of the initial 2 weeks, once the bandages are off, was very much like 15 minutes of like, hey, here's a band, stretch it, do some knee slides, do some quad sets, put the NMS devices on, and then they would come over for 10-15 minutes, a little bit of massage. Always recommended ice at the end, which is, obviously it feels good in the moment, but I can't imagine it was great long term. And yeah, I was there for 2 hours, and even when I was active and doing weights, I was in the weights room doing 2 hours worth of weights, and I probably got 15-minute one-on-one, which is just massages and hey, just keep stretching, do some heavier quad sets, get into the Bulgarian split squats, and just wasn't really solving the problems that I knew I had.
And so their strategy to solve the lack of range of motion was to force range of motion.
Exactly, yeah.
Their strategy to solve the weakness was to give you more exercises.
Yeah.
And the strategy to stop the pain was to put ice on it.
100%,
okay.
Yeah.
So contrast that to what we did the last 2 visits. So how long was the visit that I saw you last time and today?
Yeah, 30 minutes. Okay. Last time, 30 minutes today.
Okay. And how much of those visits was me with you hands-on and me with you doing exercise?
Yeah, it was like 90% hands-on, 10% exercise. But you were with me the whole time. You were guiding me through, you were filming me, you were counting, you were testing me.
Okay. And so did it feel like your strength went up after just 2 visits?
100%, yeah. And even just like some of the niggles, like the stiff low back, like some of the hip stuff, I just feel like, night and day compared to when I started coming in.
Okay. And stability?
Much better, yeah. Like I think there's work to go there, but I think the work, like Rhett's obviously got me doing the stuff that I need to be doing, and I'm feeling much better now than I did 30 minutes ago.
Okay. And he asked fantastic questions. And some of those questions were like, how do we keep moving forward? He's in Tennessee, I'm here. So we're obviously not going to do a lot of hands-on stuff. So what can we do and how can we strategize for him to do things on his own? Asked really good questions about exercise progression, broke it down and got him to learn that first step is to maintain facilitation. Mm-hmm. Second step is to increase muscle endurance. Third step is to finally strengthen and increase strength. Mm-hmm. So now when we jump on Zoom calls, I know and he knows what we're looking at when I run him through a screen, because every time I'm going to run him through a screen so I can see what he's doing, get some feedback from him what that feels like strength and stability wise. Then we can move forward with exercises, and we've already broken down a lot of the thought process with the exercise that we did with him here now, so he's going to understand that when I'm breaking things down to him over the phone. Mm-hmm. So I would not have been able to do what I did with him on a Zoom call. So what I tell patients is I've got to see you hands-on at least twice just to get going and get things going and set the table so we can move forward. And luckily with him, things came around really quick because he's been trying to stay in shape. He's just been held back from a knee, quads, hams, glutes, plantar flexors, dorsiflexors, hip rotators that were not facilitated. So he's constantly compensating. Now that we've got that back and he knows what it feels like to get what we're shooting for, now we can go forward with virtual visits.
Yeah, it's been awesome. Looking forward to it.
Okay. All right. So post questions, comments below, and we'll dig deeper into whatever you guys come up with.